Dr. Nate, Prime, Spirit, Medicine. Today I want to let you know how and why acupuncture works, specifically for pain relief and chronic pain. We go to specialized Oriental East Asian Medicine acupuncture school for 4 years, some of us longer. When we expand into specialties and more schooling, which I have done, we complete our clinicals during this time at acupuncture school, where we treat patients as interns, and we are mentored by supervising Chinese doctors. Among modalities used are acupuncture, moxibustion, herbal medicine, nutritional therapy, counseling, cupping, Tuina body work, and other specialties. With acupuncture, we apply needles, heat or pressure, acupressure, to specific points on the body, acupuncture points. These are hair-thin needles that I insert into these points on your body. If you are thinking that you're a bit afraid of needles, well, when I get my blood drawn, I get a little nervous around those needles too. So these acupuncture needles are a lot thinner than that. Strand of hair thin. So way thinner than the needles that you might be thinking of. Sometimes you don't even feel these ones. So the first time that I had acupuncture done on me, I felt great afterwards. I could feel it working, feeling its healing effects. The good balanced feeling of well-being. It seemed to last for days afterwards. My pain levels were relieved considerably. I felt well rested and rejuvenated afterwards. Acupuncture points run along meridians or pathways throughout the body. One comparison that I like to use is if you think of an expressway with a lot of cars, traffic congestion, traffic jam. So it's barely moving. It's a traffic jam. With this extremely thin acupuncture needle we insert into the acupuncture point on your body, you may feel this cool electrical jolt or tingly sensation through the pathway or a pleasant sensation of warmth. The needle gets the flow of the traffic moving again. So it's flowing freely and it's no longer congested. The roadway is no longer congested. It's moving freely. So it opens up the blockages in your body, increases circulation, and balances our body's pathways to get it balanced and working right again. So these pathways connect the points throughout the body that work with our internal organ systems in our bodies. With acupuncture, we can treat many issues, just about anything really. Acupuncture has been around for 3,000 years at least, possibly even longer. Only something that is effective stays around that long. Research suggests that acupuncture directly stimulates the release of endorphins and neurotransmitters, among other biological actions. As you know, these are naturally occurring substances that help to block pain perception in the brain, the natural feel-good chemicals that signal healing in the body. Acupuncture regulates these feel-good chemicals, which is a major part of healing. With my patients, I've seen excellent positive results with things like vertigo, insomnia, sleep quality, digestive disorders, back pain, hip pain, knee pain, frozen shoulder, plantar fasciitis, depression, anxiety, stress, headaches, cancer management, fertility, cosmetic facial acupuncture, fatigue, general well-being, weight management, hot flashes. We even had a stroke patient that we, got back on his path of rehabilitation. So we do a lot of different stuff. I have so much gratitude for the amazing Chinese doctors that have taught and mentored us along the journey. So much gratitude to them. Much gratitude to my fellow comrades, healers, and friends that have been along the path and before and after throughout the journey. The National Institute of Health has a number of studies that show acupuncture works particularly for chronic pain, such as back and neck pain, osteoarthritis, headaches, among others. It helps alleviate the pain. Back in the 70s, there were reports in Western medical literature about how acupuncture reduces pain sensation, which happens to change the quality of signaling along nerve cells. In a research study by Huang, Pak, and colleagues, from analysis of functional MRI data, we know that acupuncture affects many parts of the brain, including the default mode network, the limbic system, and centers of autonomic regulation. Furthermore, we know that patterns of activation and deactivation are point specific. Not surprisingly, there is an acupoint on the hand, leg, and foot that are the three most influential points on metabolic activity in the brain. The brain and how it is connected to and regulates the rest of the body. It all is connected and works together. You know this. I find it to be incredibly helpful for depression, anxiety, helps to de-stress. So many patients walk into the clinic with a massive amount of stress. It's nice to see them leaving after a treatment, relaxed, with a smile on their face. And in case you were wondering, I love acupuncture.